Hi everyone, welcome to Exercise Prescriptor. In this video, I'm going to teach you how to improve the ankle dorsiflexion mobility range of motion. Who is needed? Mostly post-ankle sprain cases, post-surgical cases in the ankle joint, and the person who wants to do a deep squat. These are all the people ankle dorsiflexion mobility plays crucial role. Before entering into that exercise, let's see how ankle dorsiflexion helps in functional daily living tasks. Ankle dorsiflexion can be happen in a two-way process. One is the foot position, which is non-weight bearing ankle dorsiflexion, moving towards the leg, which is tibia and fibula. That is called non-weight bearing dorsiflexion. And second one is weight bearing dorsiflexion. This plays a crucial role in functional tasks like walking and downstairs. These are all the activity. Deep squat plays huge role in weight bearing dorsiflexion activity. In this case, our tibia or shin part move against the fixed feet part. Now let's see how to test the ankle dorsiflexion mobility. I always prefer 5-inch ankle dorsiflexion mobility. Always assess before treat. So considering that, go closer to the wall or cardboard, something like this. Take a 5-inch. Your patient has to be in a bare feet. In this position, ask the patient to, without raising this heel, go forward and touch the wall and compare the same thing to the opposite side. If the person couldn't able to perform, measure the distance with your finger. So 3-finger restriction in the affected side compared to unaffected side. For example, your patient can able to touch this side also. Then what you have to do, you have to increase the distance through tape. You have to increase the distance through tape and increase the distance and start measure till the person can't able to touch. You measure with the both sides. So another way to test, take a measurement tape and put it over the line. First you can start with a 5-inch. Person can 6-7-inch, person can 9-10-inch, person can't. Then go closer, person can. When is the last position the person can? That you can measure with a tape, and the same opposite side you can perform. This is another way to test the ankle dorsiflexion mobility. Two mistakes which usually happen in the ankle dorsiflexion mobility test. That first one is keeping the rear leg knee so backward. So much backward if you keep the rear leg knee, this leg hip flexor restrict you to move forward. So this ankle dorsiflexion we couldn't able to test. Second mistake, when the patient have a restricted ankle dorsiflexion mobility, they tend to compensate with outward or inward. So they should not lift the medial aspect and lateral aspect of the feet. The entire feet has to weight bear comfortably. You have to perform it in a straight line. Now hope you learn how to measure or how to test the ankle dorsiflexion mobility. Come on, let's dive into how to improve ankle dorsiflexion. First variation is lengthening the muscle, lengthening the calf muscle. So my preference is downward facing dog calf stretch. So ask the patient to come to this position. From here, lift the knee, touch your both heel on the floor. You feel nice and strong stretch in the entire calf muscle. You can also progress this exercise in a unilateral way by bending one leg, other leg stretch will be more. From here you can pedal it like this for 5 seconds alternatively. Painful leg, maybe you can hold it for 10 to 15 seconds. Non-painful leg, you can hold it for 5 seconds. One problem in this exercise, older age people or people who can't able to lie on prone, weaker arms, they couldn't able to come to this position. For that we have another alternate variation is runner-up calf stretch. So ask the patient to stand, one leg forward, other leg backward, knee should not bend, keep your hands on the wall, and ask the patient to bring the front leg knee as far as possible without lifting the rear leg heel. So in this way you can also feel the good amount of stretch in the rear leg calf muscles. It also helps to improve the ankle dorsiflexion range of motion. For a further progression regression of this exercise is made up of decreasing or increasing the higher distance of the leg and moving farther forward and backward. Second variation, lunge to ankle dorsiflexion hold. So ask the patient to come to the lunge position as we test the ankle dorsiflexion mobility. From here you can move forward and hold it for 5, 4, 3, 2, 1, slowly come back. You can also increase the time holding over there to progress the exercise. Also, you can keep the kettlebell up the knee for progression of this exercise. Hold it for 5 to 10 seconds and then come back. Repeat for according to the patient needs and demands. Maybe I prefer 6 to 8 times. Third variation is ATG split squat. You can ask the patient to keep the leg on the stool or chair or something. So ATG split squat, we can do it in a multiple variation. You can focus on the rear foot hip flexor, knee mobility and ankle mobility, multiple purpose. For me, this is focusing on the ankle dorsiflexion. So I'm not keeping this rear leg so backward. So I'm keeping it in a front position. Ask the patient to go as far as possible to improve the ankle dorsiflexion. Hold it for a couple of seconds and come back. With the person facing difficulty, you can also ask the person to give something to hold for the stability. hold it for a couple of seconds and come back. So it's still difficult to the person. You can also perform this exercise by increasing the heel height or elevate the heel height. Keep the heel on the elevated surface and then you can perform. In this way you can improve the knee ankle dorsiflexion more. So elevated way also one of the good approach. Fourth variation is eccentric calf loading. For example, this exercise we can ask the person to take the support on the wall, raise your both heel, take out the one leg, slowly come to the other side, up. So I'm performing on which leg have a reduced ankle dorsiflexion range of motion. So this exercise progression can be done in the stool or this kind of wedge box. It will be more helpful to increase the ankle dorsiflexion range of motion. So we are focusing on the eccentric portion, slow controlled manner coming down. So double leg heel raise, take out, slowly come down. Double leg heel raise, take out, slowly come down. So in this eccentric calf raise exercise, progression regression can be done by adding the load, decreasing the range of motion or height, something. By activating the muscle definitely helps to improve the muscle tolerance to produce the range of motion. So another variation in this, in seated we can perform in the wedge box in seated position. Ask the patient to raise the heel, slowly drop. So there is no much load here. This is also you can consider as a first level of exercise. From there you can go for the standing too. So for the basic progression, if you don't have any weight, ask the person to come and push the hands with the knee. From here, slight resistance you can apply. You can also make this into unilateral by pressing one side. So first ask the patient to lift by themselves and then press slowly down to make it eccentric way. Also, if you have a kettlebell or something, I prefer to do with the kettlebells. So prescription of this exercise, I would like to say 1 or 2 sets if you are a beginner with comfortable, available, pain-free range of motion and targeted reps. It's not necessary go to failure to achieve maximum. 6 reps to 8 reps is more than enough. Slowly as you progress, week by week, you can increase to closer to failure or increasing the repetition, reducing the load kind of. So the final 5th variation is strengthening the ankle dorsiflexor. I'm using the kettlebell. It's not necessary to use the kettlebell initially. You can also add some resistance band to perform slowly by improving the tissue capacity, where you can go with the kettlebells also. This is also again one of the important, by strengthening the ankle dorsiflexor, it helps to pull and bring back the ankle dorsiflexion mobility in functional daily life tasks to provide good mobility and strengthening the muscle. Again, it is one of the way to improve the ankle dorsiflexion mobility in actively. In between, you can use your innovation and creativity to make a multiple variation also to make improve ankle dorsiflexion range of motion. And most importantly, each and every exercise which I performed have a lot of progression regression model. How can we select appropriate level of exercise intensity to make the person to perform plays crucial role. And not only performing this exercise, this is a ankle dorsiflexion progression. Also you have to work on the plantar flexion and other muscle inversion, eversion strengthening, as well as the knee strengthening, hip stability. So many things you have to focus according to the patient end goal or needs or demand. Hope you learned something new. This will help to improve your clinical practice. So each and every exercise you can make into a lot of progression and regression model. Already we uploaded how to regress and progress the exercise. Just please click here to watch this video after completing this video. And most importantly, as I always say, each and every human is different. Each and everyone need is different. Accordingly, assess and reassess the ankle dorsiflexion mobility, the improve the mobility demand. There is a restricted range of motion. There is a high chance of having less amount of strength too. So considering this factor, your patient may need to start with a level 2. Your patient may need to start with a 5th exercise. It's highly different between individual to individual, which is comfortable to your patients, and you can itself modify according to your patient needs and demands. Hope you learned something new. Don't forget to drop your comments about the next video. If you're enjoying this series, don't forget to subscribe and like our YouTube channel. Thanks for watching.